I'm very, very excited to welcome Anne Dimena as our guest, as our presenter for today. So a little bit about Anne before we do begin. Anne is the clinical director and owner of the Markham Lymphatic Center, and she is joining us with an experience from a wide variety of therapy settings, including hospital, home care, and private practice. She was a graduate of the University of Waterloo, where she received a degree in biochemistry, as well as the University of Toronto, where she received a degree in physiotherapy. And she is also the co-author of The Complete Management of Lymphedema Nutrition Guide. So I'm very excited to have Anne on board with us to share her expertise with our Wellspring community and everyone who is joining us today. So I think with that, I'll pass it over to you for the presentation, Anne.
Thank you so much. I am so delighted to be able to give this presentation, and I know it's a bit of a different style of giving presentations, but it's also great because these webinar presentations can reach people from across the GTA, which is amazing. So I want to thank everybody for attending, and I think it just goes to show with so many attendees how important the topic of lymphedema is and how this condition does affect so many people. And I hope from this presentation, you're going to understand more about the lymphatic system and how it's designed. We're going to be able to discuss the functions of the lymphatic system and then to highlight its management. I just want to say that this is a presentation that I do weekly off of our website. And so it is a presentation, obviously, that I'm quite comfortable with. There will always be things or questions that people have. And so I want you to feel free to definitely ask those. I've been treating lymphedema for about 12 years. And of course, writing the book gave me so much more insight into this topic. But really, the functions of the lymphatic system are fivefold. Your lymphatic system is designed to clear toxins or debris from around the cells, to circulate cells that help fight. It's part of your immune system. It helps circulate cells that help fight bacteria and viruses. It removes waste materials and proteins from the body's fluids. It obviously prevents you from having swelling. And so it's sort of your check and balance system is what your lymphatic system is, to make sure that you never swell. And if there's swelling for any reason, then your lymphatic system has to move that swelling out. So when people have surgery or they have radiation and the swelling hasn't been pumped out of your system and remains there for more than 3 months' time, that means your lymphatic system is deficient, and its check and balance and preventing swelling just didn't work. And it's also there to maintain the inner balance of the body, so the body's inner balance. And this is sort of a picture of the lymphatic system, and those little gray circles that you'll see sort of distributed around your body are the lymph nodes, and the lines that are connected to them are the lymphatic vessels. And so I just want to highlight that there are lymph nodes in through the neck, all the way down through the groin, composing around 500 to 600 lymph nodes throughout our body, and a network of lymphatic vessels that would be around all of the cells, draining the fluid that would sit all around the cells in our body. And so lymphatic fluid is really what we call extracellular fluid, so fluid that is outside of the cells, and that's what your lymphatic system is clearing. And so in your underarm, you have between 40 and 60 lymph nodes. In the neck, you have around 150 to 200 lymph nodes. And through the abdomen, around all of your organs, you have a lot of lymph nodes, the remainder of your lymph nodes really. So around 300 lymph nodes would be in the abdomen and in the groin of your leg. And those are responsible for then clearing fluid from the leg. And then the organ lymph nodes are responsible for getting rid of all of the toxins and fluid that would be around the organs. Then you also have what we call lymphoid tissues. So that includes the thymus, the spleen, the tonsils. So those are tissue organs that would contain lymphatic, would contain cells of the lymphatic system. And so you'll see this is a head and neck view. So people have head and neck cancers. There's this intricate lymphatic system. that goes behind the skull bone, up and around the ear, under the jawbone, and up and through the cheek area and down through the neck. And so 150 to 200 lymph nodes in such a small area means that there is such a dense amount of lymphatic tissues in that area, showing how important it is to capture bacteria or viruses and detect invading organisms that could enter in through the mouth or the nose, and to send those fighter T cells to kill the bacteria and viruses. And you can always think of the lymphatic system divided into 3 sections, really. So there is a surface section, which drains the skin. It's called superficial, so drains the skin. And that skin contains around 70% of the lymphatic vessels, flushing around 70% of the fluid from your body through the surface lymphatic system, which becomes very important when we're accessing it for treatment of lymphedema. Then you have that deeper system that would flush fluid from around the muscles, the joints, the tendons, the nerves. And obviously then you have the lymphatics that are even deeper around the organs. And so this is just a schematic picture of what a lymphatic vessel would look like. And so the vessels, let's say around the skin, they look like this. They have outside of the skin, you have your proteins and your water, which comprises the lymphatic fluid. You have your debris and your toxins. And the little channels, you'll see the little channels on the outside here, is where the protein and water will enter into the lymphatic vessel. And then when it enters into the lymphatic vessel, it would sit sort of in this little section of the lymphatic vessel until this valve, this little green valve, this cusp valve would open and force the lymphatic fluid into the next section. And so you kind of get this rhythmic pumping motion of the lymphatic vessels, moving fluid from the surface of the skin a little bit further along the lymphatic vessel to the next section of the lymphatic vessel until it goes down to deeper lymphatic vessels and then moves up towards the lymph nodes. And this is showing another schematic. As you can see, I really like pictures because I think it just really helps explain what things look like. So you'll see on the red side of this image is your arterial system. That's where the fluid is, or the blood is coming from the heart. It's being pumped into the limb. Let's say we'll pick the arm. If 100% of your blood flow goes into the arm through the arterial system, and then you'll see that that arterial system, the red, connects directly into the blue. And the blue is the venous system. So we call this a closed loop system. So the arterial system is actually connected at the end to the venous system. So 100% of the blood goes into your body, or let's say your arm, through the arterial system. 90% of that fluid is picked up by the venous system and returned back to your heart. But 10% of the body's fluid is that lymphatic fluid. And so in an arm, that 10% of fluid, it needs to be picked up by this green system that's in the middle, which is the lymphatic system. And so those lymphatic capillaries being at the surface of the skin, picking up that lymphatic fluid and moving it then to these lymph nodes. And the lymph nodes are sometimes in sequence or in groups. And so you'll have it pass through a lymph node and then through a bunch of lymphatic vessels again as it continues to go deeper and deeper to deeper lymph nodes before it then returns back to the heart. So all of this system, I tend to call it, is all your circulatory system. And often the lymphatic system is forgotten as part of the circulatory system. And so you really do have 2 components to your circulatory system. You have that arterial venous system that is which is a closed loop, and then you have this open loop system that has these little, endings that comprise those lymphatic capillaries. That would be the second part of that circulatory system. And all of these systems have to work together in order to keep the body's fluids constantly moving and preventing the collection of lymphatic fluid within your limb. And so this is another close-up look. So in here, you'll see these purple cells. These purple cells are your skin cells. And throughout your skin, you have all these little endings where you have your capillaries, you have your venules, so part of the venous system, and then you have these little lymphatic vessels, the lymphatic, initial lymphatic vessels that would reach up towards the skin to pick up any of that free-floating fluid and proteins that comprises the lymphatic fluid. And so what lymphatic fluid is lymphatic fluid is actually fluid that contains large proteins. So we call them large molecular weight proteins. They're the big proteins that could not fit between the channels of the veins. And that's really what the lymphatic system is moving. It's responsible for moving these large proteins. And then along with the proteins, the water will follow into the lymphatic vessel because we call these proteins hydrophilic. So they're water attracting. And then it will move those proteins and water away from the surface so that swelling never occurs. And so the lymphatic load, now this can be sometimes a challenging concept for people to understand, but I like to try to explain it because it really explains why the lymphatic system fails sometimes when people have had surgeries to remove lymph nodes or have had damage to the lymphatic system through radiation. So the lymphatic load is really the capacity of your lymphatic system in a normal individual to move fluid. And so really when your system is functioning normal, the capacity of your system is always high. So let's say your arm can clear 1 liter of fluid every single day, but really your normal activities of daily living and your normal function, your normal exercise only produce 500 mils of fluid. Okay, and that's that normal lymphatic flow and body flow of fluids that you would get. What actually happens is that you never see swelling in those individuals because the capacity is a liter of fluid that it can clear in a day, and you're only making 500 mils, so you never see swelling. So you get no edema. In someone who has a damaged lymphatic system, so it's damaged because lymph nodes have been removed or because of surgery or radiation, and for some people it's damaged because of crush injuries, the total capacity of your system is reduced. So if normally it was able to clear a liter of fluid and it's reduced because of damage and it can only clear 500 mils of fluid now, so it can only clear half of normal. But every single day you're producing more than normal, then you start to see that accumulation of fluid. And so let's say normally you make 500 mils and your capacity has been reduced to 500 mils, then you're okay. There's no swelling. But if on days where it's really hot, you've run to the grocery store, you've done an exercise program, you have a lot of stress on your plate, your body will then make more lymphatic fluid. So maybe on those days where you're extra busy, you're making 600 mils of lymphatic fluid. But remember, your body can only clear 500 mils because that lymphatic system is deficient. So what you'll end up seeing is that accumulation of 100 mils of lymphatic fluid. And so if someone's activity level remains exceptionally high for days and days and days on end or weeks on end, then you'll start to see this 100 mil build up every day, 100 mils. And then the next day you have 200 mils and 300 mils until you see a noticeable swelling. Okay, so when this happens repeatedly, that's when the swelling then becomes visible and the lymphedema then progresses. And so we'll talk about, what that means as we go. So what is lymphedema? So really, lymphedema is a swelling of a body part due to the abnormal accumulation of lymphatic fluid. It can be present in any area of the body. It can be in the arm, the chest, the leg. It can be just isolated to the abdomen if someone's had radiation to the abdomen. It can be in the groin or throughout the entire leg, or it can be in the genitals for some people who have had radiation maybe to the lower abdominal nodes. And it can definitely be in the head and neck region for people who have had head and neck cancer and had lymph nodes removed in through the neck region. It is the most important chronic complication after the axillary lymph node dissection that people have when they have breast cancer. And so it does tend to progress. And so it's really important that it get picked up really quickly and managed very effectively from the beginning, because we know the earlier it's managed, the less likely people are to have severe chronic complications from it. And the incidence rate is reported to be in the research about 23 to 38%. So I usually say it's between 20 and 40%. And again, that depends on how many procedures you've had done. And we'll talk about that as we go as well, because I have a slide on risk factors. And it does tend to occur in 70% of people who have had lymph nodes removed. 70% of the people who develop lymphedema will develop it within 2 years of their cancer treatments. But there is still 30% of people that can develop it across the course of their lifetime. And so, if there's 30% of people developing across the course of their lifetime, people always say, well, what's the longest time, that you've seen somebody develop lymphedema? And I always give the example of a client of ours who had developed lymphedema 34 years after having her breast surgery. And so that was because obviously she had aged. She was in her 50s when she had her cancer surgery, and she was in her late 90s when she developed lymphedema. And that was because she had a series of events going on. She had gotten into a car accident and had a little minor whiplash injury. And that was, developed some neck pain and some tightness in through her shoulders, which then started the progression to her lymphedema. And so that would be the longest standing case. But any sort of insult along the way can kind of trigger the lymphedema later on. And what I tend to see typically in our practice is, as people start to return back to their normal activities, their normal exercise routine, their normal workload, and their normal work-life balance, this is typically when we do see the lymphedema develop. So it's important to find out strategies to slowly return to all the activities that you enjoy doing if you are at risk for lymphedema, so that you can hopefully prevent the lymphedema from developing. So the risk factors would be the number of nodes that you've had removed. So typically if you've had 10 or more nodes removed, you're at a higher risk. And this is why they typically will do sentinel node biopsies for people. Sentinel node biopsies were to lessen the extent or the prevalence of lymphedema. And the extent of the radiation that you've had. So if you have a small radiation area, you're less likely to develop lymphedema than someone who has a larger radiation area. And if they've done radiation direct to your underarm, your axilla, or to the inguinal lymph nodes, so the lymph nodes in through your leg or your hip, you're more likely to develop lymphedema. If you've had an infection after your surgery, so you've had a wound infection or an infection at the drain site, you are increased risk. Post-surgical drain time, so if your drains were in more than 2 weeks, typically you are at higher risk as well. If you have a lack of mobility, so you're not very active, or, after surgery, you're a little more sedentary and not moving your, your shoulder, your legs as much as you should, trying to improve that range of motion, like the exercises you would get after your surgeries. If you're not doing those types of things, then we do see higher rates of lymphedema in those people. And then, of course, obesity is also a risk factor for developing lymphedema. There are 2 types, and I always highlight the 2 types because sometimes people have a primary lymphedema. They just didn't realize until they develop secondary lymphedema because cancer. But primary lymphedema it really does occur at birth, where people have a damaged lymphatic system or a deficient lymphatic system and could develop later on in life. Secondary lymphedema is a collection of the lymphatic fluid that is really due to a disruption. So it's damage to the lymphatic system from injury, from surgery, from lymph nodes being removed, from the radiation, crush injuries, those types of things, falls or breaks. And the diagnosis is really based on exclusion. So we really do take your medical history and all the things about you and then diagnose it. Obviously, if you have secondary lymphedema because of cancer, it obviously is quite easy to diagnose. We often want to rule out a lot of other, obviously, health factors like kidney issues, liver issues, and heart issues. If you have leg lymphedema, we will always try and rule out whether or not there are major organ issues as to the reason for your swelling. So there's a lot of problem solving that obviously goes into a diagnosis of lymphedema for some people. And for some people, it's a very clear-cut and easy diagnosis. Typically, we see that with breast cancer-related lymphedema. If someone has swelling only in one arm and we know that it's the side that was damaged, then it's pretty easy to diagnose it as lymphedema. And the diagnosis is really based on whether or not you have a measurable distance or difference in swelling when we measure the girth difference throughout your arm. If the difference in measurement is 2 centimeters or more in at least 2 consecutive areas along the arm. And then if anybody has questions about that, I can explain that further. But we do use the measurements to guide our diagnosis. And that's really just based on research and what the research shows to be the gold standard for diagnosing lymphedema. But the signs of onset of lymphedema are really important. And I think sometimes the signs of onset come very, very early on and are often missed. We want to try and get people in stage 0 lymphedema. So that's when there is no swelling at all and they have sensation of swelling. So often with early onset of lymphedema in stage 0, people will say they have heaviness, aching, and pins and needles. But at that stage, there is no measurable swelling. So this is very, very early on. And if we catch people in that early stage, we're hoping that we can put a compression garment on those people and teach self-management skills and hopefully some exercises to prevent the lymphedema from flaring up. And so there is quite a bit of research to guide how we treat and manage people in stage 0 lymphedema. So the signs of onset of lymphedema, so feeling of heaviness or tightness, bursting sensations, that would be, maybe into a stage 1 lymphedema. Increase in size of the limb or puffiness in an area, feelings of heat in the limb, shooting pains, pins and needles, or aching in the area. Tightness of clothing or jewelry is usually a pretty telltale sign if people's clothing does not fit or if your shoes are very hard to put on. After abdominal surgery, sometimes people feel tenderness or bloating in through the abdomen, a feeling of swelling in the thigh after removal or radiation of the inguinal or the pelvic lymph nodes. And we know that cellulitis can definitely be the first sign that somebody has a lymphatic deficiency and can definitely start someone's lymphedema. So if you've ever had cellulitis, you are definitely at increased risk for developing lymphedema, and very important to reach out and find resources to help you. And then signs of worsening lymphedema. So if you're someone who's on the line and you already have lymphedema and you're wondering, should I do something about my lymphedema, or is there anything more that I can do? Signs of worsening is you get recurrent infections. So you're having infection after infection. Sometimes we see people who've had infections, every 2 or 3 months before they find help. If your compression garment that you're normally wearing becomes too tight, if your pins and needles, develop to be stronger, or you start to develop pins and needles in through your fingers and toes, if the numbness in the area is progressing or getting worse, if the skin becomes thickened or rough, you have rough areas, that's definitely a worsening of your lymphedema. If you're getting discoloration, like a redness or a little bit of a brown color to your skin, or you have hardened nodules or blister-like nodules on the skin, that's definitely a progression of your lymphedema. If there's lymphorrhea, which is a leaking of through the skin, so if there's a little pore or a little hole that develops, and sometimes the pore is virtually impossible to see except you see this clear or yellowish fluid on the skin, that's lymphorrhea. And that's obviously when your lymphedema has progressed to the 4th stage of lymphedema. And we would really want to manage that aggressively because that lymphatic fluid is very damaging to the skin. If you're developing fibrosis or hardening in the area, so, if you feel your arm and you're starting to feel like it's no longer soft, but there's this thickness or hardening, that's definitely a progression of your lymphedema. Or it can progress to show that you have a decrease in mobility or function. Other factors. So not everyone who's at risk of getting lymphedema will develop it. And some people are at risk, but they don't develop it. Some will develop lymphedema right after their treatments and some later on. And those at risk should take measures to prevent it. What's the treatment for lymphedema? So the treatment for lymphedema, the gold standard of care is called combined decongestive therapy. It includes skin care, manual lymphatic drainage, compression, which has 2 stages, bandaging in the intensive phase, and then garments, and then exercise. And I will encourage everybody to make sure that the therapist that they see will deliver combined decongestive therapy, not just manual lymphatic drainage, and not just giving you a compression garment. Some people will be okay with just a compression garment if we catch them really early, but if you're a little bit further along in your lymphedema, these things are not the only way to get the best results for your lymphedema. And you want to try and get the best results that you can right from the beginning so that in 20 years down the road, you're not seeing a progression. Skincare. So it's really important to have good skincare practices. It's important to make sure that you try to avoid any injuries to your skin, no bug bites, no, burns or sunburns. Try to avoid any injuries. Definitely, pedicures and manicures, you should not be cutting the cuticles, and whoever does them for you should be very careful not to cut the skin. Any injuries to the skin can introduce bacteria into your limb and can then cause you to develop an infection, which then can cause you to develop lymphedema or cause your lymphedema to progress. And typically when it comes to skincare products, we want people to use lotions between the pH of 4 and 6. And that's to make sure that your skin stays healthy and it's free of cracks. And if you're using compression garments, I encourage people to use products that do not contain petroleum. So no petroleum. Petroleum will break down the elastic in your compression garment. And I do want to highlight this. In the book that I wrote called The Complete Lymphedema Management and Nutrition Guide, there is a section completely on skincare and the research behind skincare, why we choose the products that we choose, and also a list of the research that dermatologists have done to show which products actually sit within the right pH range. It is so important. Sometimes people are using the wrong products on their skin and they're not seeing an improvement in their skin quality. Dry skin very, very well after you have a shower or a bath or your skin gets wet from washing your hands. And you want to make sure that you always dry in between your toes for people with leg lymphedema or who are at risk for it. And you dry the creases behind your knees or in any skin folds that you may have. It's super important because these skin folds can cause chafing if they're wet, and people can actually develop these cellulitis type infections in those skin folds and obviously make your lymphedema worse. And I mean, there's an entire section in the book on skincare, and I can go into more depth with anybody who's interested in that. But manual lymphatic drainage is another component, and this is a gentle skin stretch technique. And it's done to stretch the skin maximally so that we move lymphatic fluid. So the lymphatic system has its own rhythm. Its rhythm is 5 to 10 beats per minute. When we systematically stretch the skin like we do with manual lymphatic drainage and work the pathways correctly, moving lymphatic fluid from a congested area or a broken area, rerouting it to a secondary pathway, we can increase the rate of fluid movement, the beating of the lymphatic system, if you want to think of it that way, or the pulsing of the lymphatic system, to 20 to 30 beats per minute. So we're getting 4 to 5 times more lymphatic fluid moving per minute when we do manual lymphatic drainage. And this is why it's extremely important to include this in your management plan. Only when you increase this rate of fluid movement will you activate and open up those lymphatic channels at a faster pace so that you're picking up more of the protein and more of that water that sits around all of those cells, giving you that uncomfortable swelling that you have. And that will then minimize the swelling. So the pressure that we apply when we do manual lymphatic drainage is quite light pressure. I used to say it's only the amount of pressure that you comfortably put on your eye, but typically for most people, we can apply more pressure, similar to the amount of pressure that you would use to pet a cat or a dog. So it's fairly light pressure still, but you want to make sure that you maximally stretch and move the skin and benefit for all the hard work that you're doing. And it does help remove the proteins from the tissue. I can do a demonstration at the end if we have time, but we are working alternative pathways. We're the shoulder and going down the arm towards your fingers, and then we're working that all the way back up. And we're really accessing these surface lymphatic vessels, carrying the fluid away from a congested area into a decongested area. Bandaging. So bandaging is a component that needs to be done. And this is a client who came into our office. He had significant leg lymphedema. And so we were able to bandage him with an intensive of 3 times a week for about 4 weeks. And he was really immobilized. He couldn't walk up and down and was stuck to his house for 2 years before he found help. We put bandages on him, which is a 3-layer bandaging system. So it's not a tensor bandage, but it's a specific bandage designed for lymphedema. It's a very short stretch bandage and it delivers a high amount of pressure. And it's actually quite comfortable to be in. But we give pressure to the skin to try to move the lymphatic fluid into those vessels and then cause the lymph to shrink. But we need to do manual lymphatic drainage first and then apply the bandaging after. And the bandaging can be worn for about 23 hours a day. Taken off to shower. And this is what arm bandaging looks like, and that is what leg bandaging looks like. So it is a 3-layer bandage system where you have a protective layer, a padding layer, possibly a foam layer, and then these bandages over top. And I want to talk about the last principle of CDT, which is exercise. And this is the principle of helping create a muscle pump. And a muscle pump, when combined with bandaging, and when combined with a compression sleeve, actually creates what we call a positive working pressure. That positive working pressure can be so powerful on helping you move lymphatic fluid through your lymphatic system, because the exercise against the bandage is just helping stimulate those lymphatic vessels, similar to the manual lymphatic drainage technique, to activate the lymphatic vessels so that they'll open and close at a faster rate as well. So never underestimate the importance of exercise. And we see some of our clients do extremely well with managing any flare-ups in their lymphedema by doing their exercises. So, walking versus Nordic pole walking. So there's some benefits to Nordic pole walking because you activate the arm lymphatics for people who have arm lymphedema. Water exercises are extremely important because of the pressure of the water. So swimming can be extremely helpful. I always talk, because I'm a physiotherapist, about postural exercises for people with upper limb lymphedema. And we definitely want to make sure that we balance any muscle imbalances that you have, because the muscle imbalances can also create a lot of strain in through the area, causing you to develop shoulder pain or hip and low back pain, which can then help progress your lymphedema as well. So all of these things should be addressed, but definitely exercise is extremely important, and making sure that you are doing exercise. Weight exercises can be done, so people can do weightlifting. Pretty much, I try to return people back to the activities and exercises they were doing before. Within reason, of course, there are always some exceptions, but we try to return people back to the exercises they were doing before, because it is so extremely important on getting people back to doing the things that they love. Compression looks, once we get to, I guess, after bandaging, we want to put people into a permanent compression, and that would look like a sleeve or a glove for someone with arm lymphedema, or even a vest if you have breast or chest wall lymphedema. Head and neck, there are compression garments for head and neck lymphedema. Definitely stockings, and there are Velcro options for people too who have trouble getting stockings on, for people who have leg lymphedema. And there are night compression garments as well. So the sky's the limit when it comes to compression garments. Don't give up on the first try if what you've tried at the beginning is uncomfortable. There is always a way to find a compression garment that meets the needs of everybody. And this is my book. There's a promo code. We've had it on all of COVID. If you want to order the book off of the website, it's LAO 2020. And if you want it signed, I'm happy to sign it and mail it to you. The promo code, I believe, gives you the book for $20. And it's normally $27.95. You can get it at any major bookstores. And obviously you can get it on Amazon as well. So I am free to ask any questions. I hope that was helpful. I know it was pretty quick, but if anybody ever wants to hear more, you can always come into the Friday sessions that I have. You'll have to join that and come into the Friday sessions. They're Fridays at 12 o'clock right now. And we're definitely a smaller group, so I can always answer any questions that people have.
Wonderful. Thank you so much, Anne, for that presentation. I'm sure everyone found the information that you presented very helpful, and we definitely have a lot of questions, so I'm just going to jump right into this. So our very first question. If someone has varicose veins, weak valves in veins, are you more likely to get lymphedema in any part of your body?
So if you have varicose veins, those do tend to be in your legs. We have seen people with varicose veins, obviously, in the arm if they've had, if there's someone who's been having dialysis. But so I'm just going to address the legs. So I'm assuming you mean in the legs. If you have varicose veins in the legs, you're more at risk for developing lymphedema in your legs naturally. So we do have people in our office who have venous insufficiency related lymphedema. That's strictly just because they have varicose veins. And if you've had lymph nodes removed from your underarm and you have varicose veins in your leg, that doesn't make you more at risk for developing lymphedema in through your arm. So I hope that answers the question.
Thank you for that. And so our next question, does developing axillary cording in your arm after mastectomy and sentinel node biopsy predict getting LE?
Yes. So there are research studies showing that people who have axillary web syndrome are more likely to develop lymphedema. So it's extremely important to get the range of motion back in through your shoulder. So often when people have axillary web syndrome, we typically see a reduction in their range of motion, or a slower progression or improvement of range of motion. And that will definitely predispose you to lymphedema. But really, axillary web syndrome is a spasm of the lymphatic vessel system, or a crystallization of the lymphatic fluid within the lymphatic vessel system. And so right away, when people get cording, we know that their lymphatic system is struggling with moving lymphatic fluid. And that axillary web syndrome can definitely fluctuate in time. So sometimes people have it right after surgery. It resolves within 2 weeks, but it comes back 3 or 4 months later. It needs to be treated for sure, even if it comes back the second time. And then you need to learn some strategies on maybe self-manual lymphatic drainage to try and prevent lymphedema from developing.
Thank you for that. And so our next question, it's a two-part question. How can one detect the early signs of lymphedema? And part two is, where can I go to check if I have the early onset of lymphedema?
So heaviness, aching, and pins and needles are usually the early onset. So if you have those symptoms, if you notice swelling, that's definitely that you are into stage 1 lymphedema. If you are a client or a patient of Sunnybrook, they do have a lymphedema clinic. They will measure you. Otherwise, you can reach out to, therapists in your area. You can reach out to our clinic as well. And I'd be happy to assess. You can reach out to therapists. There's the Lymphedema Association obviously has a website, and they have a listing of therapists in the area, because I do recognize that not everybody that would be on these talks would be close enough to our clinic to see us. What you'd see is your therapist will measure your unaffected side, so the side you had no cancer on, and compare it to your affected side. I just want to caution that if you're only 2 centimeters different, you could be 2 centimeters different because of normal muscle bulk if it's on your dominant side. So if, it's your right hand and you're saying, well, my right hand is 2 centimeters bigger than my left, but I also had breast cancer on my right side. Well, sometimes we're a little more developed on the side that we use every day because we use it for all of our activities. And so this is why they actually say, when we're measuring people later on after they've had their cancer surgeries, that we're about 60% wrong in diagnosing lymphedema early onset because we don't actually have pre-surgical measures. And so to my knowledge, there aren't any hospitals that are doing pre-surgical measures for lymphedema so that we get a better idea as to who develops it early onset. Typically in our office, though, if we see more than 2 centimeters, then we know it's not just muscle bulk, and we would then progress with doing treatment and giving compression.
Thank you for that. And so another question is, you mentioned diagnosis often. Would you be able to tell us who typically provides a diagnosis of lymphedema?
Well, that's a tricky one. So, the doctors are there obviously for your resource 100%. You should be discussing it with your oncologist or your doctor. And your oncologist would maybe be a better source than a family doctor, because an oncologist just sees more cancer patients. And so they would see more lymphedema. They would be able to help. Often physiotherapists like myself, who are specialized or certified, I guess to say, certified in treating lymphedema, see hundreds of cases every week, really. So we are often the best people to help diagnose. And we'll often work in conjunction with your your cancer support center. So if it's, Sunnybrook or Princess Margaret, we'll often work in conjunction with the oncologist to get more testing or answer any of the questions that we may have. But typically it's us.
Thank you. And so our next question, if a lack of exercise increases the risk and returning to normal activities also increase the risk, how do we determine a happy medium between what is enough exercise or too much?
That's right. So you're right. So at the beginning, when you're first starting out, a lack of exercise can actually cause you to develop lymphedema, because your range of motion often won't return to normal. And then I often say that the other reason why lack of exercise causes lymphedema is because when your muscles are very weak, they're not able to develop a strong enough muscle pump. And that muscle pump, we realize, is so vital to helping move lymphatic fluid. It squeezes the lymphatic vessels that would be deep lymphatic vessels that run through the muscle. And you're right that if you overdo the exercise, you can also develop lymphedema. So it is always about finding this fine balance. And this is one of the things I'd always coach our clients on, our patients on, is how to return back to the activities you love to do in a very slow and progressive way. And to also be very keen on monitoring what your arm or your legs feel like as you're returning to those exercises. Not everybody has aching, heaviness, and pins and needles. Some people have a very slow onset of lymphedema that actually is easy to ignore until their shirts don't fit or until their shoes don't fit. So it's really important to have some sort of strategies for determining whether or not you are developing lymphedema or it's getting worse. And it could be learning how to self-measure. So in the book, I have a section on management and self-measurement. And I show key points in self-measurement and talk about when you should start to measure your limb. And I usually promote all of our clients to do some form of self-measurement, especially if you're changing activities or if you're changing your diet.
Thank you for that. So our next question, when doing self-manual drainage therapy on my legs with a small paint roller, do I pull the roller up or down?
So the direction of lymphatic fluid is always upward. That's always the direction. If you're going down towards your toes, then you're actually just pushing fluid into your foot. So you're always trying to move the fluid out and get it going back towards your heart. Now, using a paint roller can be helpful. It may be not as effective as just learning to do manual lymphatic drainage with your hand, because you want to make sure you're getting skin stretch. The paint roller will give your skin some stimulation, let's say, but it isn't usually maximizing the stretch. But I do know, and we do teach people to use paint rollers if they have a lot of arthritis or they have a hard time reaching.
Okay, thank you for that. Our next question, would you be able to define what stage 0 lymphedema is?
So stage 0 lymphedema is a stage where there's actually no measurable swelling. So when we measure, we don't measure any difference. Gotcha. That's stage 0. And they just have symptoms: heaviness, aching, pins and needles.
Okay, thank you. And our next question, should compression garments be used to prevent arm swelling, for example, when flying for prolonged periods of time?
Well, so the debate is still out on that. There's a lot of talk back and forth amongst the international community, and it was a big topic at the National Lymphedema Network conference on whether or not a sleeve will actually prevent you from developing lymphedema when you fly. So there are a lot of factors around flying, I tell patients, that trigger lymphedema. And sometimes people can take 20 flights and have zero swelling, and then take their 21st flight, and that's when they get swelling. And we don't always know why. It could be that there was a change in cabin pressure. It could be that you were more dehydrated on the plane. It could mean that you weren't as active on the plane or moving as much on the plane as well. So I'm not a big proponent of using sleeves to prevent lymphedema for flying unless you are at significantly high risk. Because a poor fitting sleeve, if the sleeve doesn't fit you well, if it's not measured properly, can actually trigger lymphedema when you fly. So this is another thing to consider.
Thank you for that. And so just another question. Do members need a physician appointment to be able to, if they wanted to come see you for treatment?
No, nobody needs to have a physician referral. We are a physiotherapy clinic and allowed to see patients without a referral. So patients often self-refer. A lot of physicians, obviously in COVID too, you're not seeing your physician as frequently as you may like. And so we definitely have direct referral from patients all the time.
Okay, thank you. And so another question, does lymphedema ever go away or does it need frequent treatment?
Your lymphatic system is always deficient. We will say, and I will say, that we do see some people who we are able to bring back to stage 0 if they were in stage 1 or stage 2. If you're in stage 3, where there's fibrosis, hardening, a lot of fatty deposits, and the swelling has sat there for years and years and years, we're likely not going to be able to bring you back to a stage 0 or a stage 1. For early treatment people, there's some research, and we also see this in our office, where we are able to reverse people back. And we do have several people in our office. We don't see it often with leg lymphedema, but we do see it more with arm lymphedema after breast cancer. So the answer is it never disappears, and your potential for it to flare up at any point can happen. And so I'll give you an example. I had a client, she had lymphedema. We managed it really early. She had 7 years where she did not need to wear a sleeve. She did not need to do anything. And then she started skiing, started doing more activity, and her lymphedema started to come back. And so then we had to start doing treatment, and she obviously started to have to wear a sleeve again. And so there is always that possibility for it to flare up.
Thank you for that. And so our next question, should people or can they use weights if they do have lymphedema?
So weight training is possible. So Strength After Breast Cancer is a program that we offer in our clinic. It is a program of exercise. It's progressive exercise. It talks about how to progress exercise. And it's really done by Catherine Smits, the Catherine Smits group in the United States. So there are research articles. It was the PAL study. And so it's physical activity after breast cancer lymphedema. And what they want to do was take a group of lymphedema women, and they want to see if we took these women and we gave them progressive weightlifting, would their lymphedema get worse? And what they found is the lymphedema didn't get worse. But what they found with the people who did the PAL study is that they had less flare-ups, they had an improved quality of life, and they had obviously improved strength and ability to do more activities of daily living. So I'm always definitely a proponent for exercise. I think it is vital to learn how to do it properly, and to make sure that you're very progressive in how you do it, and you know what to look for in terms of signs and symptoms of worsening, so that you know how to scale it back if that happens.
Thank you for that. So our next question, what about the heaviness that comes and goes? Is that a sign of LE?
Yes. So that's early stage lymphedema. So if there's no measurable swelling, but you have heaviness, aching, or pins and needles, that's an early sign of lymphedema. So that you could be a stage 0 lymphedema with no measurable swelling, but have that heaviness and achiness.
Okay, thank you. Our next question, how does stress affect lymphedema?
Well, stress affects everything. It affects every condition, right? There's research showing that stress is obviously the number 1 killer. But there is research to show that when people are under high amounts of stress, their lymphedema is worse. And this is typically what we see in our clinic as well. COVID hasn't been kind to people right now either. and producing a lot of stress. And so we do see some people that are seeing lymphatic swelling increase because of the stress that they're experiencing. So what stress does is it closes and tightens up your muscles. And when you tighten up your muscles, you tighten those deep lymphatic vessels and they become very narrow. And so fluid doesn't freely and easily move through those lymphatic vessels. So deep breathing can often help with loosening up the muscles and help with moving lymphatic fluid.
Thank you for that. So our next question is rebounding good for leg and groin lymphedema?
It depends. There isn't any research on rebounding that I found for the book. I was really hoping that there was, because we would love to be able to tell our patients, yes, get a rebounder. For some people it works, and for some people it makes them worse. So often if people have a rebounder, I just tell them to start off very slowly with little movements, and maybe just a couple of minutes at a time. So there isn't a lot of research on it.
Okay, thank you for that. So our next question, if people are experiencing swelling in their neck, face, or veins, how can they reduce their swelling? And the second part of this question is specific to your clinic. Do you do facial rolling or other techniques to reduce swelling at your clinic?
Yes. So I taught a course maybe about 3 years ago now with integrative lymphatic therapies on head and neck cancer-related lymphedema. It is definitely one of my passions because I think head and neck cancer patients experience lymphedema in a different way than leg and arm lymphedema patients experience it. And obviously it affects a lot more things. It affects swallowing, and often people feel a shelf in the back of their throat, and sometimes, fluid or food gets caught. And so it's really important to manage head and neck lymphedema super early before there is fibrosis and thickening, which we do tend to see early on with people with head and neck lymphedema. We can use compression garments. We do myofascial releases, like we have a whole physiotherapy sort of plan for people with head and neck lymphedema, but we do manual lymphatic drainage. We can do internal lymphatic drainage in through the mouth using a glove, obviously. If someone has swelling within their cheeks or at the back of their tongue. And it's a very different approach. We're often not rerouting fluid, but we're stimulating the area where lymph nodes have been removed, because the lymph nodes on the back of your skull and underneath your skull and the back of your neck actually drain the back of your throat and the base of the back of your tongue. So we tend to see a lot of improvements with that. But then you need an exercise plan to also help you continue to get that good lymphatic flow.
Thank you for that. So for those members who are on steroids, what impact, if any, do steroids have on lymphedema? And if there is an effect, could tapering the dosage help lessen the severity of the impact?
So steroids can cause general edema, which can obviously worsen lymphedema. So that's what steroids can do. And obviously with steroids, people do tend to gain weight. And so maybe that excess weight also can trigger the lymphedema. Tapering will always depend on your doctor and your medical reason for taking the steroids. So I would never do that without consulting your physician first, because obviously the steroids in your case, and I don't know what your situation is like, and everybody's situation and health reason for taking them is different, will determine whether or not you're able to actually taper them to see if your swelling will reduce. But yes, steroids can definitely add to that swelling.
And thank you again for your presentation and all the information that you did share. So it looks like we are about right on time to wrap up the session.